All right, so we're gonna go through a few exercises here for the rotators and pelvic tilt. Let's start with the feet pretty wide, not crazy wide, just wide. Toes in, heels out. Nice long spine, shoulders back. We're gonna hinge the hips back, find the glutes, find the hamstrings, find the paraspinals, hinge back, keeping the spine straight, chin in for the back of the neck to stay long. Find a nice stretch on the hamstrings, and then come back up to vertical. So just a clean, wide leg hinge. You want to make sure that you find the sweet spot for the pelvis. Not too much anterior tilt, not too much posterior tilt. Think of the sacrum being aligned with that L5. And so from the side, it looks like this. Nice long spine. The hips are going back in space. The toes stay on the ground. Toes in, heels out. From vertical, hips go back in space. You can use your arms if you want to go a little bit deeper. You can bring your arms forward as leverage. So one more. And we're going to add on to this. Now we're going to go side to side. Think of your tailbone pointing to your heels. I point to one heel. I stretch the opposite adductors. Point to the other heel, opposite adductors. I'm going to start vertical. And I'm going to little by little hinge back 1 inch at a time. My hips are going side to side and back. You can let the knees bend a little bit on this one. We're mostly looking for an easy stretch, warming up those adductors. And you go back and you go forward. So from the side, this looks like this, and then from here, hinging, hinging, hinging. So we get all the angles of the adductors. You can do arms forward if you want. You can get pretty low there, play with it. Shouldn't be any pain on the groin. Next we have the woodpecker rotation. I'll show it again from both angles. So right foot forward, left foot back. A few very important key points here. Feet are hip width apart, back heel is off the ground, and the toes are straight. Pinkies totally straight, outer edges of the feet totally straight like train tracks. We're gonna hinge, put the weight over the right leg, make sure both legs are straight with the knees unlocked, but we're not sinking into a crescent pose. We're just putting weight and actually hinging that hip back. So this right hip is going back, back, back to get the hamstring. Once we're on the hamstring, we're gonna feel a little bit of glute, but we're gonna feel more of that glute when we rotate the torso to the right. And you wanna make sure that this movement is led by the hips, not by the torso. The rotation has to happen at the hip joint, not so much on the vertebrae. And this, what I'm doing here, is a relative internal rotation of this right thigh, which helps us stretch the external rotators and load the internal rotators. So I got the foot, the weight on the front foot. If you want to make sure that you're turning just the hips and not the torso, you can hug yourself here and rotate with just the hips, keeping the torso straight. Let's try the other foot. So let's go left foot forward, right foot back. Find the alignment. Big breaths. Make sure feet are straight, train track. Alignment of the pinky edge. Loading into that left hip. Find the hamstrings. Find a little bit of glute. We're thinking about sending your sit bone, that left ischial tuberosity, back away from the attachment on the bottom of the knee from the hamstring. So we rotate Now we're loading the rotators. Come back to center. And we want to make sure that, again, pelvic, anterior, posterior tilt, pretty even. Neither hip rising too much over the other. So every time we come back to center, we check the alignment. If you want to play with just the hips, not the torso. And there's two ways of working this. You can work it for reps, where that focuses a bit more on the muscle and the movement pattern, or you can also just hold it for a minute or maybe up to 2 minutes, and that works a little bit more on the fascia and also on the tendon. So let's try this from the side. Again, right foot forward, left foot back. We're really looking for that ischial to move back in space. So check the feet, check the knees, check the pelvis, three-dimensional alignment into the hinge. And then rotations. So the rotations really focus on the rotators. Internal rotators engage, external rotators stretch. Try with the torso static. I'm not kicking the hip to the side, I'm rotating on its own axis. Make sure that you don't end up vertical here with the rotations over time. You want to make sure that you're actually loading. You should really feel that on that right leg. Let's switch sides. Left foot forward, right foot back, hip width, feet alignment, knee alignment, hip alignment, spine, hinge that hip back. Rotations. When you come back to center, don't go past it to the other side. At least for now, so you can learn what center means and practice that pattern. Over time, if you want to come out of it a little bit and give it a little bit of a stretch on the adductors, that's fine. But if you go too far into it, you might find that compression on the SI joint. So we're going to try to create space on the SI by closing the hip in and opening the backside of the ilium where the sacrum attaches. Try a few with the torso straight. And we'll step forward. All right, let's go on the ground. We're gonna work on our lower abdominals and hip flexors here. So just bring yourself all the way back on the ground. And just a few times, let's do a little bit anterior posterior tilt. So on the anterior tilt, there's a big arch here, a little bridge on the low back. On the posterior tilt, we're crushing those vertebrae down to the ground. Anterior posterior, anterior posterior. And then let's keep the posterior tilt, the tucking of the tailbone, crush your spine to the ground. That's the most important piece. Big tuck, big squeeze, all abdominals engaging. Shoulders stay down and do your best to keep your chin in. So lengthen the back of the neck. Keep the shoulders down. We'll warm up with just one at a time. Left heel drags all the way to the knee being straight. Ankle flex, internal rotation. Very important that you're squeezing those vertebrae down. So what we're doing here, switching sides, is the heels dragging. It's touching the ground, but there's no weight on it. The knee goes all the way straight. What we're doing here is we're keeping core activation, abdominal contraction, with tension on the hip flexors, but we're letting the hip flexors stretch in a shortened position, if that makes sense. I'm not letting my leg externally rotate here because that would stretch the psoas and the iliacus out of their effective length. So I'm keeping the internal rotation to shorten the distance between the origin and attachment of that psoas, but then I'm putting tension on it by creating leverage. So we're still stretching it, obviously not to its maximum capacity because we're still 180 degrees here, not sending the knee back behind the hip, but should work for at least training the core to be engaged while the hip flexors are free moving. Once you did a few on each side, we're going to try with both heels together. It's going to be obviously harder, so a lot of emphasis here on crushing the spine. And if you feel that sending the heels too far away starts to arch your back and you start to feel that your back is coming off the ground, then that means you probably went too far. You want to bring it back a little bit, and maybe that's your effective range, right? That's as far as we're going to go, as long as we can keep the spine on the ground. All the way out if you can, or slightly halfway, 3/4 of the way. Try to keep those ankles flexed the whole time. You could hold it up in the long position, whatever long is for you. Hold it, breathe. That's another big piece, right? We have the abdominals, the hip flexors, and the diaphragm too. And a lot of times people will brace their core through their diaphragm. So we want to make sure that the breath is not locked and that we can do the breath moving, the heels moving, while the abdominals are bracing the spine. A couple more of this. And we'll counter pose with the bridge. So for the bridge, we're going to tuck the tailbone, lift the hips up, keep the toes and knees together, and give it a little bit of a inner anchor squeeze. So we're going to engage the adductors here, squeeze the adductors, squeeze the adductors, squeeze the glutes, and lift the low back here, pin a little bit with the ribs, tuck, 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 pin, pin, pin. So we have tension on the front, tension on the back. We're bracing our spine from both sides. Keep a nice even tuck. And then we're gonna roll down to this ground, one vertebra at a time. Okay, so now we're going feet together, soles of the feet together, knees out to the side. Here we have a passive stretch for the adductors, but we're gonna add a little anterior posterior pelvic tilt. So primarily here we're stretching the adductors, and I guess you could call it flossing the hip joint, that greater trochanter in the acetabulum, getting some range of motion here, looking for any signs of pain on this position. You may want to extend the legs a little bit, that might help. And from there, we're going to do a counter pose, which is knees in, feet out. So you just heel toe your feet out and bring the knees towards each other. You could also do a few tilts here. And we'll finish by resetting the SI. So just real easy here, right leg crosses over the left. Rotation to the right, so the knees are going to the right. Keep the legs internally rotated, and now here we're opening that space. We're closing the hip in and opening that SI on the left side. And you could hold this for a long time. Certainly a minute, 2 minutes, maybe even more if you want. Try to keep that left shoulder on the ground and the head straight. Let's try the other side, uncross, maybe do a little mini bridge here to
Make sure your spine is straight, and then left leg crosses over the right. And we send the knees to the left. So now we're opening the right SI. Shoulder on the right side stays down, head is straight. Couple more breaths here. And we'll bring it back to center. Last bridge to reset the spine. And then legs straight out to the sides, arms to the sides, and we'll just rest here for a few seconds just to integrate. So we're gonna let the body be heavy, heavy feet, heavy legs, heavy hips, heavy torso, heavy arms, heavy head. Breath rising, breath falling. And of course, you could stay here for as long as you like. When you're ready to come up, just moving the toes, the ankles, the fingers, the wrists. Big inhale, stretch the arms back, legs forward, bend the knees, roll on to your side. You can wait here for a couple breaths. And then coming through seated.
And up to standing. All right, good work.